is sometimes very
Giant ones
unusual
multiply with.
localization of this element. And this is very important moment because the giant form, unusual localization may be indication of the possible presentation of this disease. Such in this clinical case, you can see condyloma acuminata. You know about the condyloma acuminata is a viral genesis disease in genital part, and now I present you unusual localization of condyloma acuminata on membranous of oral cavity. But very important moment that this element is a result of the sexual intercourse by orogenital way, and the penetration of papillomavirus on the membranous of oral cavity and the formation condyloma acuminata on the membranous of oral cavity. Don't forget that you know two forms of condyloma. Condyloma acuminata, condyloma lata. Condyloma lata is a clinical signs of the syphilis. And don't forget about these two forms of condyloma. Next is element is molluscum contagiosum. You know about this disease. This disease is a viral genesis disease, and you know that this disease is characterized by possible formation of multiple papules, and inner structure of this papule is a cheese cottage-like structure. This disease is transmissible, and in the HIV disease, you can find multiple elements of this disease, unusual localization, and very often abnormal in size. You can find multiple giant form of this disease. You can see giant papules, specific papules of this disease, and you can see these inner structures such as cheese cottage-like and umbilical-like penetration on the central part of this element. Giant form of this element and localization on the face. Next group is bacterial diseases. And in this group we can include the staphylococcal pyodermia. You are informed about this disease. You can see the folliculitis, multiple folliculitis as a result of the inflammation of hair follicle, and specific in this situation, tendency of penetration in deep parts of the skin. You can see here the tendency of the penetration into the deep structures of the skin, and you can see that these elements are covered by necrotic crusts. You can see the color of this crust. The color is black and necrotic crust because the situation of immunodeficiency, this control is practically zero, and in this it is identical to zero, and in this situation you can see this tendency of penetration into the deep structures and formation of this necrotic crust on the surfaces of these elements. Then next, I am sure that you remember this disease. The name of this disease is psychosis, and this disease maybe fungal genesis, maybe bacterial genesis, and your patient needs in laboratory investigation for the differentiation, but the psychosis, bacterial genesis, maybe as a variant of the clinical signs of HIV disease. Don't forget about this possibility. We can include in this group of bacterial diseases, we can include the moment in this group of bacterial infections, we can include the syphilis. You know that in duration of syphilis, at the onset of this disease, you can find urbus durum or chancre as a rule single element. In classically variant, single element. But in patients with HIV disease, you can find not single but multiple chancres at the same time. This clinical case, multiple chancres syphilitic genesis, and you can find these elements at the same time. Not only one or two, but sometimes it's maybe 8 and 10 elements at the same time, and don't forget about this possibility. Next group of diseases is fungal diseases. Fungal diseases, first is neoplasma, viral infections, bacterial infections, fungal infections. Fungal infections, oropharyngeal candidiasis. Oropharyngeal candidiasis. Oropharyngeal candidiasis, etiological agent is Candida albicans. You are informed that this disease is characterized by possible formation of very thick spot on the surface of the tongue, and in classically variant, if you remember, in classically variant, the removing of the spot is very easy, but in patients with HIV disease, this process of removing is very difficult. And then this spot is very thick and maybe transmission to trachea. That's why the name oropharyngeal candidiasis, because you can find the change not only on the oral cavity, but you can find the change, specific change on the membranous of trachea. That's why this name oropharyngeal candidiasis. Next clinical case is similar candidiasis, oropharyngeal candidiasis of the tongue. And next, in this group, we can include onychomycosis. Onychomycosis, or the involvement of nails in process and destructions of the nails, fungal genesis. And that's why the name onychomycosis. Don't forget about the onychodystrophy. Onychomycosis in classically variant. You can find the specific change on the first and on the fifth nails. On the first and on the fifth nails. And the involvement of other nails, you wait this process after 2 or 3 years, no earlier. But in situation of HIV disease, the duration is very aggressive, and that's why you can register the involvement of all nails in process in the duration of time nearly 3 or 5 months. After 5 months, after the onset of this disease, you wait involvement of all nails in this process. And don't forget that this aggressive duration of disease maybe is an indication of HIV disease. Next, and the very specific the area of the onset of this disease. In the classically variant of duration, of formation of this disease, we wait initial change in the distal part of nail, but in the situation of HIV disease, we wait for formation of change in proximal part of the nail. And that's why this localization of change is very specific for this disease. Next is this disease, and the name is disseminated cryptococcosis. Cryptococcus neoformans is a fungi which is responsible for the formation of a deep mycosis. Deep mycosis is a kind of variant of mycosis which is characterized by possible involvement of internal organs in formation of different granuloma in these internal organs. And you can find this formation of granuloma not only in internal organs, not only in it, don't forget that you are face your country. And you must remember about this. Now, about the elements which you can find, this multiple granuloma, and this multiple granuloma you can find in inner organs, and the genesis or formation of this granuloma is fungal genesis, and etiological agent is Cryptococcus neoformans in this situation, and this disease is widespread in African countries, in ocean countries, and that's why don't forget about this granuloma or cryptococcal granuloma may be as indication or possible presentation of HIV disease in organism. The next is this moment, that's the last group, miscellaneous dermatosis. Miscellaneous dermatosis, and from this group very often you can find patients with dermatitis seborrheica. You know about this disease, dermatitis seborrheica, disease which is characterized by the sculling of the skin, is characterized by the specific color of the scales. The scales are, in this situation, are gray and then very intensive itching. The area of localization is face, but this clinical case is very important and interesting. Why? Because you can see dermatitis seborrheica, you can see the element of Kaposi sarcoma, and you can see the element of molluscum contagiosa. These three clinically important diseases are presented at the same time, such as the condyloma, such as molluscum contagiosa, such as Kaposi sarcoma and dermatitis seborrheica. Next disease is psoriasis. You know and you are well informed about the psoriasis. You know that psoriasis is characterized by possible formation of multiple papules which are covered by scales, and the localization of these papules is extensor surfaces of joints. But in this situation of HIV, we weigh the formation of this element on the flexor surfaces of extremities first, and the second, that very often you can find the formation of these elements in groins, such as in the clinical case, formation of the psoriasis. The name of this form is psoriasis inverta. You can find this element in the groins localization, and this form of psoriasis is very rare in classical variant, but very often in patients with HIV disease. And differentiation of this way of differentiation is laboratory investigation. By this way you can differ these two diseases, psoriasis inverta and the tinea cruris, because you know that tinea cruris on fungal disease is characterized by possible localization in the groins. Next, hairy leukoplakia. Leukoplakia, this disease belongs to the disease of membranous, and the information will be presented de novo at the chair of gynecology, because this disease will be described at the chair of gynecology, but the area of localization genital part, and in our situation you can see the change of membranous, and membranous is pearl-like, because you can find a very strong element on the surface of the membranous, pearl-like name of this condition, of this situation, and this is one of the clinical signs of this disease. The next, the similar hairy leukoplakia, the similar change in the membranous of the oral cavity and formation pearl-like elements. Next, formation of aphthous stomatitis. You know about the stomatitis, you know that the stomatitis is the inflammatory process on oral cavity, and you know that the stomatitis may be herpetic genesis, herpetic gingival stomatitis, but in this situation is aphthous stomatitis. After we can translate from Greek such as ulcer, because this form is characterized by formation of multiple ulcers on the membranous, and this ulcer is very painful, very painful. But it is not herpetic genesis in this situation. That's why we can separate this form and name such as aphthous stomatitis as a clinical variant of the stomatitis generally, and this variant of the clinical form of HIV disease. Then, this very interesting symptom because it's a scarring on the area of using of intravenous using of drugs. Because in this situation, if you find the scarring, you can imagine that this person may be from the group of high risk group. But don't forget that the similar scarring you can find on the skin of the patients with diabetes mellitus and other diseases of connective tissue. And don't forget about this possibility, because this scarring may be not as a clinical indication of the patient of high risk group. And last, which we can present on the skin surface, is the generalized lymphadenopathy. You can find enlargement of lymph nodes and enlargement of these lymph nodes at the onset of the neck area. And earlier, when I presented you the information about the herpes virus, I told you that in this situation we weighed participation of 8 types of herpes virus in the process of formation of generalized lymphadenopathy in patients with HIV disease, because it's a true moment that the viruses which are responsible for the generalized lymphadenopathy belongs to the A type of herpes virus group. And then you can find the enlargement of lymph nodes at the onset of the neck, and then you can find enlargement on all body, peripheral lymph nodes. About the other possible clinical signs of these diseases, unfortunately, nearly 90 or 80% of the clinical signs of this disease belongs to dermatology. But this disease is not included in our field of competition. Up to this moment, this disease in my country is included, in our country is included in field of infection diseases. That's why the information about the HIV disease will be presented once more as the chair of infection diseases. But our information is more full, and that's why we are sure that this information which you will receive at our chair is more full than, because the other clinical signs, such as change from the gastrointestinal tract, such as change from the endocrine system and so on, will be presented as the chair of infection diseases, and such as the methods of treatment of this disease. This is information which I'm sure is useful for you. And now, if you have any questions, I can ask them. No.